HIV or human immune deficiency virus. It is a virus that attacks the immune system, specifically targeting CD4 cells, which are type of white blood cells crucial for fighting off infection and diseases. HIV weakens the immune system over time, making it difficult for the body to defend itself against virus infections and diseases. HIV is transmitted through certain body fluids, including blood, semen, vaginal fluids, and breast milk. The most common modes of transmission including unprotected sexual intercourse, vaginal, anal, or oral, with an infected person, sharing needles or syringes contaminated with virus, or from an infected mother to her child during childbirth or breastfeeding. If left untreated, HIV can progress to make advanced stage known as AIDS, acquired immune deficiency syndrome. AIDS is characterized by severe damage to the immune system, leading to the development of opportunistic infections and certain types of cancers. Some symptoms of HIV. The symptoms of HIV can vary from person to person and can differ depending on the stage of infection. It's important to note that not everyone infected with HIV will experience symptoms in the early stages. However, here are some common symptoms associated with the HIV infection. First of all, acute retroviral syndrome ARS. This occurs within a few weeks after contracting the virus and is often described as a flu like illness. The symptoms may include fever, sore throat, fatigue, muscle aches, swollen lymph nodes, rash, and headache. Phase 2, asymptomatic stage. After the initial ARS symptoms subside, the virus enters a stage where it may not cause any noticeable symptoms for a prolonged period. However, the virus is still active and can be transmitted to others during this stage. Phase 3, symptomatic HIV infection. As the virus progresses, symptoms may begin to appear. These can include persistent fatigue, unexplained weight loss, recurring fever or night sweats, chronic diarrhea, oral thrush, a fungal infection in mouth, persistent cough, and wrist circuit infections such as pneumonia or skin infections. Advanced HIV or AIDS. Without proper treatment, HIV can lead to the development of AIDS. At this stage, the immune system is severely damaged and individuals may experience severe and persistent symptoms. It's important to remember that the presence of these symptoms alone is not enough to diagnose HIV infection since they can also be associated with other illness. The only way to confirm HIV infection is through specific HIV testing. If you suspect you may have been exposed to HIV or are experiencing any concerning symptoms, it is recommended to seek medical advice and get tested. Treatment of human immune deficiency virus or HIV. The treatment of HIV involves the use of antiretroviral, which is a combination of medications that targets the virus and help manage the infection. The primary goals of HIV treatment are to suppress the replication of virus, preserve immune function, prevent the progression to AIDS, and reduce the risk of transmitting the virus to others. Here are some key points about HIV treatment. First of all, antiretroviral therapy ART. ART involves taking a combination of different antiretroviral drugs, typically in the form of daily pill regimen. These drugs work by inhibiting the replication of virus at various stages of its life cycle. By consistently taking ART or as prescribed, the level of HIV in the body can be significantly reduced, allowing the immune system to strengthen and function better. Second, treatment initiation. The decision to start ART is based on the virus factors, including the CD4 cell count, a measure of immune function, the viral load, amount of virus in the blood, and the presence of symptoms. In recent years, treatment guidelines have generally recommended starting ART as soon as possible after diagnosis, regardless of the CD4 count or symptoms. Treatment 3, adherence to medication. Adherence to ART is crucial for its effectiveness. It is essential to take the prescribed medication consistently and is instructed by healthcare provider. Skipping dose or stopping treatment can lead to drug resistance and reduce treatment efficacy. Point 4. Monitoring and follow up. Regular monitoring is essential to assess the effectiveness of treatment and ensure the virus remains suppressed. This involves periodic blood tests to measure CD4 cell count, viral load, and other relevant markers. Healthcare providers may also monitor for potential side effects of medications and adjust their treatment regimen accordingly. Point 5. Prevention and management of opportunistic infections. HIV weakens the immune system, making individuals more susceptible to certain infections and diseases. In addition to ART, preventive measures such as vaccination and prophylactic medications may be recommended to prevent specific opportunistic infection. Prompt treatment of any infections that do occur is important to prevent complications. Supportive care. People living with HIV may benefit from additional supportive care, including counseling, mental health support, and access to social service. Proper nutrition, exercise, and healthy lifestyle also contribute over well-being and immune health. It's worth nothing that while ART is highly effective in controlling the virus, it doesn't cure the HIV. Research continues to explore new treatment strategies, include long-acting medications and potential cure approaches. But as of now, lifestyle treatment is generally required for individuals living with HIV. It's important for individuals with HIV to work closely with the healthcare provider to develop a personalized treatment plan and receive regular medical cares. It will be good to treat HIV. Thanks for watching.